Welcome to the beautiful Children's Wisconsin. This is our main hospital, which is a freestanding children's hospital that has dedicated space for the care of pediatric hematology, oncology, and bone marrow transplant patients. It is located on the same campus as the Medical College of Wisconsin and the Froedtert Medical System for adults, which provides many opportunities for collaboration in both research and patient care. We take care of our patients and their families in the Mac Fund Center for Cancer and Blood Disorders, which is comprised of multiple clinical care areas. Our hematology and oncology clinics share an outpatient clinic space and waiting room that is staffed daily by members from both specialties. Within the outpatient clinic, there are dedicated workrooms for our hematology and oncology teams. Within the oncology clinical space, there are workrooms dedicated to each disease-based team that has patients on a given clinic day, including leukemia lymphoma, musculoskeletal oncology, neuro-oncology, and survivorship teams. Many of our multidisciplinary clinics, such as sickle cell and cancer predisposition clinics, also work out of these spaces. The fellows work alongside attendings, nurses, advanced practice providers, dietitians, and other learners in these workrooms. The Mac Fund Center for Cancer and Blood Disorders also includes a day hospital. Our day hospital is utilized for transfusions, outpatient chemotherapy administration, IV iron and factor infusions, acute sick visits, and procedures that do not need sedation. This area is staffed by an advanced practice provider who works in tandem with the inpatient team to provide care to patients receiving outpatient care. This is the dedicated workspace for this team within the day hospital. Each patient is assigned to a private room within the day hospital on their day of their treatment. There is a common space that we encourage patients to use when it is safe for them to interact with our staff members and other patients. Our child life specialist working in the day hospital provides toys, games, art supplies, and other activities to help make their time spent receiving treatments more enjoyable. The bone marrow transplant outpatient clinic runs within the day hospital clinical care area. They have a workroom that is used by their clinic team. They conduct outpatient visits and provide outpatient transfusions and treatments as needed for their patients in BMT-dedicated private patient rooms. The Mac Fund Center for Cancer and Blood Disorders has an inpatient unit that is located just down the hall from the outpatient clinical care areas on the 5th floor of the main hospital. This is a 24-bed inpatient unit that is used for the oncology and bone marrow transplant patients. Hematology patients, oncology patients, and BMT patients are on 3 separate teams. The hematology patients requiring admission go to a separate inpatient unit on the 10th floor. The inpatient service teams will also care for our patients who are in the ICU or post-surgical floors, as well as consults. Every inpatient room is a private room with its own bathroom and space for parents to sleep. The inpatient teams are comprised of medical students, residents, advanced practice providers, nursing staff, case managers, dietitians, and pharmacists, along with the fellow and attending provider. There is workspace for the teams on the inpatient unit that allow them to be nearby for any acute patient needs, but also provides a space to work as a team on patient care coordination and follow-up. This space also allows the provider team to be available for nursing questions that come up before and after family-centered rounds occurring on each service. There is a family lounge located on the inpatient unit that includes an ice and water machine, refrigerator, stove, TV, and computers that are available to patients and families. There are also gathering spaces for patients to see extended family when visitor restrictions allow. This area allows families to make their own meals if they desire, and helps provide a change of scenery for patients who have prolonged inpatient stays. Many families also meet other families in this area, building a community of support. The fellows have a private office space that is located in one of the Children's Wisconsin administrative buildings next door to the hospital. All of the buildings on campus are interconnected via tunnels and walkways. This space is heavily utilized by our second and third year fellows during their dedicated research time. Each fellow has a workspace assigned to them that remains their space for their 3 years of fellowship. I think what I appreciate the most about our fellowship program is our team's commitment to fellow education. One of the ways this is evident is that we are a fellow independent program, meaning that we are able to be very flexible with our curriculum, tailoring it to the individual career goals of each fellow and not towards our service needs. We truly believe in training each fellow for the career that they want to have. We are fortunate to have the breadth, depth, and variety of diagnoses and faculty expertise to allow us to train fellows to succeed in all subspecialty areas of pediatric hematology, oncology, and BMT. We are able to do it in an environment overflowing with fun, caring, supportive people, and in a vibrant, underrated city with a high quality of life.